organization don't come and go, but this one come for stay because in aim, not the heartbeat of God for help the poor and needy. It's the Sidra Women's Organization.
Sidra's Women Organization. They come for help with the poor and Sidra's Women Organization.
The Sidra Women's Organization will be launched officially on Saturday, the 7th of January 2023. This historic event go unfold inside McKinneyton, right now the SLTU Hall. The time now 10 o'clock now morning. As the main aim of this organization now for help the poor and needy, the Sidra Women's Organization would look for extend invitation to all Soriat organizations, especially other sister women's organization, for can witness this colorful ceremony. I say we McKinney fumble them. Let we not forget the date again. Now Saturday, January 7, 2023, 10 o'clock now morning, and the place now the Great SLTU Hall, McKinney Town. This organization is sponsored by a daughter of the swell based in the United States of America, Madam Sidratu Aminata Kamara. The Sidra Women's Organization, helping the poor and needy, is our passion. Is our passion.
They come for do their best to the poor, east, west, south, the east, and the north.
Good morning and welcome to another edition of the program Rest Right On. We are on YouTube and on Facebook. Well, we want to tell thank you to you who don't join me this morning. We appreciate your time and everything. Of course, we did talk about members we get we challenge way for reach 100,000 subscribers by the end of this month. And today now almost the end of the month because today now the 30th of December 2022. Okay, as we talk so right now, we subscribers we talk about 62,903. We want to tell you all plenty thank you. That not the one YouTube and on Facebook we talk about 33,000. Thank you very much. Una really they show some love and we appreciate una. And like always I could tell una say inside this program we normally look at the different newspaper them. But because of the holidays and we know this is a festive season, most of the paper them not actually they come on. They not they actually come out. So we take the program to another level. So today inside the program we actually want to look at how the health sector turn like 4 years with the health sector. Who say we dey? This not the question where we actually ask today, and this not the thing where we want to come discuss. Well, we get one big senior citizen inside the country, where same way so na member of parliament, where don't join me inside the program for let we talk about this particular issue. Let we see who side we there as a country, as a nation, and who side we actually the go. 2022, what did it be mean for we? With regards to the health system, we as well expect to get another person way for joining inside the program. But in the meantime, we will go and see waiting this we honorable member get for say with regards to the health system. And of course, we will get for know some other things them we get for do with all of the health, waiting different documents them say, how we for make sure say we go on and put things them in place. So this person where we get today na the chairman parliamentary oversight committee on health and sanitation in name na Honorable Moses Bemba Joki. Except if I miss anything with regards to that particular name there. I think I get it right?
Well, I go in the first place I will tell you thank you because that word is jockey, which is J-O. And normally I can tell people
so that's why I'm confused.
Yeah.
Okay. So
and if you
I know they get you.
Go on.
Okay. So the other thing we are going to ask you is very important because knowing how they are going to talk to you as honorable member of parliament, then I not ask you the question. Constituency waiting, sir.
Me, I come out from constituency 091 in the Bond district. In that 091, it comprises of Boom Chiefdom, Banda Kemo Chiefdom, Sobini Chiefdom, and a section of Jong Chiefdom. 9 comprises of that constituency 091.
Okay. So the truth now, you name Jockey. I know of Jockey, I know of waiting, but Honestly, today I think I go say I don't learn another thing inside the country with another surname, Jockey, especially with the what's in name mean? La name.
Well, that particular name day, now we forefather and begin forget that name day, so we don't carry, don't give him. So yeah. So we get 49, even the history for going to them, I'm not able to go into the history but because I don't know much about that. The powerful tell me they don't pass away. So the only thing take up for saying a jockey, Jorki, just like how they pronounce Jordan, which is
Yeah,
yes,
Jockey.
exactly.
All right. That's amazing. Thank you for way you don't make. I don't know how for pronounce the name Jockey. All right. So honorable. Let me start with the recent year under review. Ending 2022. I don't know. I know they see you camera don't look go off.
Well, na boku programs the company camera means like this guy for la put on off, but see, they go. You see.
Okay, not a problem. Let me go small.
Really,
You na the chairman committee on health and sanitation na the House of Parliament. In other words, you na member of Parliament. And the oversight committee na committee down there where they watch waiting the Ministry of Health they do. How then they implement health programs them? How then they make sure say health business na the country look okay, for the citizens them. So 2022. So far, what you don't see with regards the health business in the country?
Yeah, of course, my brother. In the first place, I thank you. I tell you plenty thank you. The health issue in the country, as you all know, I want to say a little bit better improvements they come as compared to the previous. Because if we come to the indexes, like the maternal mortality, the number of women that will die pambele, that one they don't reduce over the years. Then the picking the way they die before then they reach the age of 5 years. That one they self don't reduce. So I feel say that's a very good laudable idea as we they go along. That's a benchmark we take for say yes, the health situation at the country they improve small. Just like how we can talk, Rome was not built in a day. So this means na small as we go along. We did try very hard because one, Boku health centers and of course they know rehabilitate them. They know they build other health centers, health programs they come, like the free health care system we've been in at the country. That also I will talk say it don't improve, even though we know say they cry a day. Because anything we then see in free, you know what that one they mean. When once anything is free, everybody go rush at them. So that will make, in fact, the free health care drugs not contain at the centers because as they reach people, then they go there for let them get their health. Then apart from that, the shortages where they come at the health centers, I don't pass around, I don't realize for saying one major contributing factor. The major contributing factor is that cost recovery drug not they among the free health care drug where they come. So person where they go to center is sick. The health workers and self food in at the center. For the fact that they not get other drug, person go is sick, they not go let them go for they not go die. I feel say then the dog can inside that free health care drug, then they begin to treat the people the way they know the inside the category. This all don't make the free health care drug not the last. So but overall, I want to tell you for say really the health situation at the country is a little bit better because more structures are coming up and health centers, health workers also, very well, a mass improvements don't they because they don't they get pin code and that don't make them don't feel happy for letting them in the health sectors. So these are the few things and we actually they happy with EBC. Everybody will be very, very much overwhelmed and glad because majority of health workers that almost nearly 4,000 now they don't get pin code. And where possible they go with EBC, they get small thing at the end of the month, that will make itself look happy. So then other improvements. One other thing we don't happen again, almost everybody they look happy. Any side with that particular setup don't go. Then the mobile clinic we don't come. 4 buses don't come. Every time the member pertaining to health treatment, it is inside that motor. Any side where you go, then it treat you. If any case where they go meet you, they above them, we be say them for 45. Then 45, and if you bring you come, then they can't see to you for make sure say you don't get the correct treatment. So these are the good things really happen in the country. We are happy. I believe you are happy overall.
Yes. Everybody need to be very much happy. But in as much as you talk about the reduce, if we can go, how you could say almost we don't reduce in terms of the child health, neonatal, childbirth and all, the maternal mortality.
Well, I know you want forget wrong figure. We are not up to date for now, but they been look like say any 100,000 women then, belly woman they will go into labor with for born. That figure they people they may dial up to 1,167 something like that. If you're not correct, sorry for that. That figure don't count on drastically to 770 something like that, instead of 1,167. So that's not a good reduce. Then the Pekin itself when they die from before they reach 5 years of age. That one they say even they around. I'm not really sorry for this particular one
It's
because
okay.
yeah.
All right.
But
so,
it don't
so,
really.
Now look at this thing. In as much as you say, structures they don't do right now, then they put in place for make sure say they get facilities them up. Forget the facilities one, and a good thing that nobody knows it's not a good thing. But of the things that we make up of the facility, then the question. I mean the things that we for make them save lives of picking them, especially when they go for go born, picking them woman them, that's a very big challenge.
You are quite correct, but that one they say just the cabinet beginning to come. That one they say the improve because when we get Bemok centers, they will don't get almost all inside all the districts then, and then Bemok centers and they don't train nurses them where they take care of rebel woman then and also the picking them. Almost all the centers and get them and specialized people then they will call the midwives then they pandemic big centers then all. What it can be said in case of anything, if they don't try, they're not able to deliver that person, then go refer them as quickly as possible. That also don't bring to mind the availability of ambulances where they all over the districts now. Where it be say if woman not able born or picky don't come in critical condition, we then go refer them as quickly as possible. So if they say they don't they in place, then that means the structures they also. I've been on telling for say Rome was not built in a day. The health situation been there down. But now if we try for putting people into their strategic positions, then the midwives and the MCHs and the SCHs and the CHOs of course, then they oversee them people there. My brother at the telephone free is quite better for now compared
so
to the
look at
previous.
this post, yeah. I just watch Washington Post. Yeah. They actually published inside May 6, 2022. The heading where we say where pregnancy is a deadly gamble. Sierra Leone is one of the riskiest places to have a baby. One teen fears repeating her mother's story of dying in childbirth. So let look something again. Waiting, they say downside a bit, because they try for tell we look at the statistics we encounter it. They say 1 in 20 women in Sierra Leone die as a result of pregnancy or childbirth. According to the latest United Nations estimate, most often from losing blood, the West African country consistently ranks as one of the deadliest places on earth to have baby. Only South Sudan and Chad count higher mortality rates. So this now waiting and say, practically every death is preventable, but a decade of civil war destroyed much of the health system. So yeah, this now waiting Washington Post talk about we country. What do you make up of this?
Yeah, I know say that particular statement, that particular post, it not go down well with you, even me, we are the answer to the questions that we put and any other meaningful Sierra Leonean within and even outside the country, because that kind of image for every country gets not really fine. But the reality, just get for talk. That is the situation we've been on the happen inside this country. Now that make in fact the health situation with the fact and tooth and nail for no make sure say then kind of situations we bring can down. And now that's I've been trying for top, but because I'm not too posed now for let I tell you the exact figure. Now I make I just tell you for say a drastic reduction don't they? With the effect I'm very hard. We know there are causes of
actually not fancy figure, because sometimes the figure not can match up the actual thing. So I not get problem. We forgive you if you not come with figures then. But let we look at reality in the ground. Yeah.
Yeah. Now the reality I try for tell you to be frank enough.
I need for ask some questions them. You know the chairman na parliament, meaning you get the right for let una do oversight. And una even get the right for do like on the spot check without announcing una visit. Una can go and watch waiting the happen. Are correct?
You are quite correct.
How many times una don't do on the spot check without announcing?
The spot check, of course. If I tell you the right thing, I just do them up to just 3 times because for let parliament move, for let committee move, go any side, and not really easy because the country's in situation. But that not means not for performing work. But that will be non the do. But as frequent as how you can remember, no, that one day you're not too frequent. So but only that.
The 3 sides when you don't do them. Who you do you on the spot check?
I don't do an Connaught. I don't do an Kinhama Road. I don't do an Waterloo, so the areas there I don't do.
So take me through what you find out. Let's start with Connaught. What you find out on the spot?
We will go na Connaught in the first place. At that particular time, we will go. The hospital not be too fine, but we will do the sports check. We are called the health workers, the doctors. I put on to them for say that this is not the Connaught we know. So therefore, the situation of Connaught is not too good. Then, of course, from that you go there now, you go see a massive improvement in terms of health situation in Connaught Hospital.
So then, of course, not a secret say. Plenty workmen in the field on the spot check where unannounced visits from una when mean say if una dey do am continuously it creates impact and most people because I can remember when we president take over when they go na you build we see how people they run for go work early morning. That shows say if on the spot check una intensify them, una put more strength on that one day, it will create a lot of impact. Let me go to Cottage for example. You don't ever visit Cottage unannounced?
Cottage are not visitor unannounced, of course. Me one go there, but not that me one did not go create much impact anyway. I go there, I talk with the in charge, I talk with the doctors and the rest because I go for actually see the attendance list, how the nurses and they go to work and the rest. So, but that's not create much impact. I just actually advise them for say, well, indeed. Health now everybody in your own business. So therefore,
why did you want Greenway go there as the chairman not create impact?
No. Wait till I try for talk. Me one. Let me tell you for free. If snakes them in the worker in group, if you say person will go tamper for go kill.
No.
But because snakes they go one in one, you don't realize for say you not get much respect because if you want good they go kill you. But that anyway, just a fun anyway. Me not to say me one green, me go one or do go create an impact. It go create an impact. Now the impact I try for tell you. Wait till I go see and advice. You see, so I very well know say any other time when they go now, I go believe for say a mass improvement go they just like I try for talk that because they not be the experts for say I go there.
This is not the thing we I want for say because this same Cottage where you go so. We be on the see a lot of things then they will lack na Cottage. For example, if woman, we not say for lay you go born picking a blessing, for lay you bring her life in this world. But we find out say even the Cottage, from even the one day where they walk right inside the Cottage, where they attend to woman the way they bring life in this world, so then they tell we every now and then say problem. For example, water not been the run na Cottage. Now it don't better small. For as small as needle, syringe, catheter, and other things them not available na the hospital. And we still see say governments they pull resources every time for supply to the hospital there, but enough not be done in that area then day. So una on the spot check as oversight committee will create impact because na parliament, na the drivers of the country. But in the case of USAI, una fail for do certain things then the people then go suffer. And na the people in this way they represent.
You really quite correct. I agree with you. Let me tell you this particular thing. So, where I go, the issues you highlight, it's like say you did it. I've been getting forget that kind of issues with them. they highlight all the problems. And so we are commodity waiting I do discuss with the minister. From there, I say, Honorable, I know very well, I know the situation of Cottage. And one thing where I go discover, where I go, we have been check the records. Most of the cesarean sections where they perform at the hospital, now the surgical CHOs them they do. So that one they appraise it very seriously. So the things that we're lacking, where I can talk to the minister, of course, he called NMSA, the director, and it come with the issue to him. So what's happening? In fact, the few next days, you see where you talk about our sport check is so important. What's happy? Then all the things that we they not been get, now the hospital where consumables and the rest, then take and carry and go na cottage. So I believe say that means sport check we have been do, it been get for yield a good dividends.
The year don't done, and we did look forward for see how 2020 Utalek. Not a secret say anytime we will go inside election here them. Much work not to be done. For example, that on the spot check or that even announced check one they go do. Una say not go do one because if you get plan for come back na parliament, you get plenty work for doing a bomb na your area where you come out, right?
Yeah.
So what are you feel say 2023 go get for Talek with regards to health? Because now you don't talk about and some of we workman then like small picking. If you not put EIB in there for see waiting and they do, they know they do the right way on them for do and then they take advantage of situation. So how you feel say 2023 go Talek for we the people them?
I see 2020 for say we get for double the effort. Then I want in no saga, no child play. We get for double the effort because the 2023 as I pass around where I don't can home where they go around Boku centers and don't well. Even though rehabilitation they go on some centers, but bus then they don't be a destructive mechanism to the health centers. Boku bare bus infestation. So I don't see say that one day if actually the Minister of Health put strategies in place in making sure say they repel them based in Mandem Basin and not go fight for the health centers. Then I want to I don't can discover. And the health workers they wouldn't need, most of them they didn't know how to reach areas. And if they didn't know how to reach area, that means we need to encourage them or else they not go sit down there. These are the things that we I don't come observe we at this short time we I don't come. So therefore for 2023 to come in, it look like say I get for engage the Ministry of Health very seriously and put the issues there where me don't can detect. Even get for talk say, I say the DMOs they're not for just sit down no more na the offices They need for go and do monitoring and supervision. So that if then they go to the health centers go to the health facilities believe in me, then for don't they see the health problems the way they affect the people there, so that then we will do something towards that. But they are majority of them are just seated in their offices. These are the things. So 2023, me and you get for work. Because like this way they do today now, very important thing for the country. When they try for put me on air for talk on health issues. So then when they will then go very well know, yes, then people they mean business. So therefore, me brother 2020, really I hope we will be up there if only we intensify with monitoring system.
I see the passion in you, constituency 091 around the Bonth area, right? I want to go into your constituency, good one. I correct the constituency.
Pardon?
091, your constituency.
Yes, that is my constituency.
Okay, and you represent in the parliament the Sierra Leone People's Party, right?
Indeed, yes,
okay.
Of course.
So now we go inside your constituency because a lot of things then they inside Freetown when at the center and if Freetown they suffer from a lot of things them and I'm not able to talk how you go talk for the provinces. For example, inside Freetown, I watch in comments on Facebook, quick one. This one from Adam and Mambu say PCMH there is no running water in the operating center. Yeah, sorry, in the operating theater. Let me see another one. They say ambulance. This not too important issue them. We remember say the president being said and they give ambulance to all of the chiefdom them. But we see say for long term the ambulance and they been packed na you building at some points then distribute them. You don't monitor waiting at the status of the ambulance then because most of them don't grounded. And I know of a situation even inside Freetown. The reason why they count Freetown is because now in the nearest to raw material, it is inside the power lead on. But in some cases I don't see inside person the loss in Pekin. Now Rokupa Hospital Because, for example, then they call the ambulance driver, he go tell you, say, hey, you know, in Mutukano, you like to, now this other person now for call. All of them challenges and they. What are the update with regards to the ambulance them? How you don't see the ambulance system, the ambulance service? Where that includes for
you look like. Anyway, I don't know, say, you know, much about Salon anyway, really. Or from the interview me. The ambulance services, well, you know the sickness of Sierra Leone. This, you know, we not really need for either. Salon, we not get that maintenance culture. Now they disturb we right now. The ambulances, believe me, the president, he make sure say all the districts in this country then get the ambulances then. And then ambulances, they may not begin to operate fine. But it don't come to a time, good number of them don't scrap. Then go park, as it's scrap no more pack, then they go park. They know they maintain them again. So maintenance culture don't be a very big problem for us in this country. And that one, if we not find a way to make this country for let it go ahead, it's not going to be easy for us. So therefore, the ambulance the way back, that one day, like my own area, we call like there be 2 ambulances there, but as I talk to you now, one don't left there. The other from where they don't take Ankara and go, are not even know in we are about. Likewise, the other chiefdom. This is happening. So therefore, the ambulance system, if you not come back into place, even if we are the type of say, we will be up there.
I smile that you say you don't even know the whereabouts of the ambulance. If you went at the chairman, then the ambulance they come out now you tongue, you know Sabi. Are the one that now how you go tell it for other person.
The way about where they talk of, they don't go pack you know, not just you know a system where it's left for top. From where you been in at the center, you been the operate. Now you don't scrap, they don't take and carry and go pack for let them make they don't make her. So now that I just a sort of total a bit like top. But really, to be frank enough.
And this they make plenty people. You know, when they talk about the improved system, say a lot of picking them, you know, the number the number of picking them will be they die or woman. Very sorry. The number of women and pick will be they die, you know, don't reduce. But we then kind problem there are. We go still there within then go still the rate we say we are one of the worst, you know, place who say woman for born picking.
Yeah. Yeah, that's of course you are quite correct. But look, this Bemos health center business with them account. We have a very good important system with encounter. Where ABC woman, if you belay don't wrong, if you can in a center at least a week prior to delivery, so nothing not go happen. But the structures, you know, actually not be non come into play because for that system they work. At least a place go there where the woman can eat then they encourage them, they cook, they eat and relax and everything. So as in Bele Atmomo, they go into labor. But this system is not working. Until when you be at Obayana and one village, then travel with you. And in fact, if the ambulance know they are rampant and put you pants up 100 and bring it, which of course, you know, without that not to be, you know, will be a very good system.
Where they're able for pay for the under. But in some cases, we will see them, they put them per wheelbarrow, then we put them per amok, you know, they work out with them, they suffer. In some cases, and even force them, even when they suffer, for let them work back.
Yeah, then of course the amok business we talk we are quite good. But then be the first time business, but now with this system of ambulance, Okada business don't come, happen again. You hardly see that one day now. So therefore, I'll just talk on the ambulance system. We don't bring come, and when you see this, you don't bring come to me, not get for left to me because I don't see and you say if you don't put fire behind me now, it look like say I get for double mistake for March. Now make sure see the ambulance system really is upgraded. Because Boku don't scrap, and we don't scrap for them repair them, they don't repair, they don't go pack there. Now few no more don't left now the centers.
So like you don't talk, I'm glad that you don't actually say you go work on them things in there, you know, because you just get short term, yeah? Election are in June. And we get January, February, March, April, May, June, 6 months. So we get just 2 months, if possible, 3 months, for let we do effective work. After that 3 months, they not to secret say. Honorable, you say self go get for go first for your position, sir.
You are quite correct, but that not me say I know they do the work. In the first place, let me tell you for say I'm a health worker. I've been on in a center at the work today, so I know the issues. For that, if you go find out about the issues, not to anything it will be very difficult for me. So whether I'm in the system or I'm not in the system, still I go be part of the system, the other way around, because I want Salon for let it go ahead.
If I get a right by April, Parliament say lock, right?
Pardon?
If I get a right by April, Parliament say lock.
Oh yeah, you are
and
quite
if Parliament's
correct.
lock, it means say you position yourself in, you know, not to you didn't have the position again.
Not at all.
Yeah, so if right now you get challenges them with regards oversight, you get for take plenty things for you do oversight, and you don't make them very clear say where you want to go, you go create impact, but you don't create the kind of impact where you go able for forget. It means say after you don't left that position day in April, it could be more difficult. So this make I go back to Sarah, they say by April like election here. Proper one. We mean say even the government will command them go get for pay attention pan politics. Other na government will command when a SLPP go for the fed for party, other na APC go get for the fed for party. So the state go just don't left like a monkey dunia where all man they pay attention pan politics and the people them because it no matter if politics they every day woman they born, every day picking and the sick, every day we need things them, every day things them. The state need for operate. This not the difference between we own country and other country them like the Western world. Whereas system day, but in our own country we get structures, we don't get system.
My brother, you know the job. Whatever you talk here, I always go along with you because I get a clear picture of it. But the only thing I tell you, even if and when you see the honorable come himself, at least probably it will work even past me. So it will double the effort. But the only thing I get for create new impact for we parliament, this sports check I don't see good dividends. We really get for this are the telling for free. If only again because they put the word there if parliament support me. Because if they support me, at least I'll be able to take me group. I say, let's go under on spot check. Let's go under on spot check. That go happy. So therefore, through you, Mr. Get go talk to me leadership in the parliament for let me make sure see the health system don't improve in the country.
Okay, let me look at money business. Not a secret for say, the government they put money inside the health system. They put money, and we see donors them they put money. But when you go inside, for example, the audit report where Parliament up to this time not able for debate yet, they're not able for watch how the audit reports are like. We find out say plenty money then they missing, in terms of procurement and go do wrong procurement. Like for example, in just last audit report 2021, we find out say you get some Cuban doctors then wake come where then just spend a lot of money on them for accommodation, spend for bar, for where Kroman can say ladi dapa enjoyment and other things then all that they in the audit report they're not able for account proper one on them things and them. So you find out say the government and the donors them they put more money, but the one them waiting at the health sector we're supposed for use the money the right way for let the people and benefit from them, they actually not the benefit from them. You actually watch that last report here, right, and see your own sector when at the health sector, right?
Yeah, I don't watch I don't see on the health sector. We're not a very big concern, just like I talk a very big concern where EB say that particular report, in fact, we need for the beaten and make sure see we invite because we go be the first people them. I have to invite the sectors in from the health department. Let me can caution them for the why. Let them tell me how this is happening. This number one thing that we have to tell you, it happens simply because what we supposed to do, we know they do. Not to say we don't get doctors in the country. We get doctors in. If not speciality, let them go land. Let government spend on them, then go land. But most people, when government don't spend on them, then go land. Where they go now, for let them turn back now the country, they know they come. This all they create kind of problem there for we. They make we they go import doctors in for bringing them kind of the country. But I hope say with the discussions the way they go on, governments go look into that so that we train we own doctors and let them be available. We get doctors in, but we don't realize for see most doctors then get 2-3 clinics in. We then go work small na government hospital and come out and go na the clinics and the rest. This already solve the health system in the country. What if say the minister really need for act on this very seriously? Then money then where would they spend for import doctors in or where then come would they spend on them? If we spend on we own doctors in the country, that could be a better thing for Sierra Leone. And also we encourage doctors that when they go land, let them come back to the country and serve them people there. These are the good things that we would hope for. Where we say we need for actually embrace the doctors there and talk to them, let them understand reasons. Because the people that wouldn't treat in the country, now them brothers and the sisters and the women and the rest. So therefore I see no reason What if they send you for Golan, you refuse for camp? But probably that one sometimes because of salary or any other amenities. So now that no more
with Mango say the problems na the health system they are enormous. We go say na Creole, them beaucoup, they're really beaucoup, and I defeat in one. You know, I wonder why the president, because the president talk about corruption, say we fight corruption, but corruption they fight back. But I wonder why he not talk about, you know, the health system, how the health system, the weak part of the health system, you know, how it will get for fight we back, even where then they put money, put everything. Because even yourself, you see say this is a very big task. And this health system, the way that the problem they with the trial, but Iboku pass with we don't even know waiting for do again. Look at this. In terms of trusting the system, you know, the health system, now the country, you think say we young government self trust the health system?
Well, that's why you know, governments not to just one arm. So until if me go trust the system, the other next man will go trust the system. But in a nutshell, I not get for give answer to that. The only thing we are get for talk is that let's put hands on them.
You not going for give me answer, but you get answer. Now look at this thing, for example. This recently, in as much as we're not able for debate it in a parliament, but una as well want for look at, you know, one thing where una as parliamentarian they ask for, we get for do with the medical. Yeah, when I get certain amount where una they ask for, say, if for be with medical, the reason being, recently one of una colleague died because of simple thing where if we not able for address, but because of the health system now we country not able for handle, una they look at I think $25,000, you know, where una for the use for go overseas and take treatment, correct?
Oh yeah, because you see the health system we they talk of now don't create all this. If actually a good health system in the country, no need let policy ask for say they go overseas for let go get treatment. But you and I know
now
very
you don't answer me question. The question will be ask you.
Yeah, but yeah, but that yeah, you and I know very well for say the health system we are not 100% good. So therefore, who say you get for go for me you get that 100%? It look like say when people they don't try now that make when you sick in the country, then go for try you. They not you know just go then they go up for say then get for fly you go oversee or the rest. Then get for try now yeah first A B C D. When they don't see say now yes they don't stop at 70 or 80%. Then they will go beyond that. Now the time that we then go request for say let them fly with you. So therefore, in a nutshell, the health system we are not 100% good. But only that we are trying. Now that no more I get for telling. We are trying, my brother. Whichever you look at them. And say I will not tell you at the start of this thing, I said Rome was not built in a day, not so? Mm-hmm. Rome was not built in a day. We are going slowly, and by God's grace, we'll be there.
We pray for that day, and we actually want to look at that day. You know, the Ministry of Health and Sanitation, they spend billions of leons every year, according to audit report, for send people there overseas. Billions of leons. Yeah. If they invest them into a health system, will create great impact, serious impact. That is a concern again for now.
Not concern for us. That money where they spend for letting them fly people then out of this country, we know say it's a concern. But let me tell you for free, if we say now we not get for do this, no just can pour into the health issue, you know very well. Then people that were supposed for be killed. At that particular moment, they not go cure. So therefore, why would they pay the system for more build the system stronger? Then at the same time, we get for they do this, we make people then go seek treatment overseas until we don't get the correct health system.
Let me look at, for example, I think Tanzania, yeah, Magufuli, for example. When it come, one of the things that we do now, that work where you begin for do that on the spot check, for example, and make sure to then fix things them. Who are not able to do certain things and then pull them and bring the one that we're able to do them and then fix the system within the shortest possible time. When it take over, it's able to fix the system, even for move the economy and other things then. Now let me look at this. Even the transformation health system, sometimes it be reach them. Like for example, we did talk about from what we begin to talk about dialytic center, say with the bill, we see the president we don't tell we say they don't ring fence the money where anti-corruption being put together. Say then go build that dialytic center there. Up to this time, we not hear anything with regards that one day, but the money still ring fence, we know as well not able for no. Una parliament, now when I get the power for all the executive arm of government to account. Every other person, and that is why you very much important. I'm very much happy for talk to you today because you now the chairman for the health sector. When mean say you very very much important. You even important part the minister of health because you need for work with the Minister of Health, put things there like when you say you coordinate with them, but you need for all them to account. Press them, let it able for work, for let the people benefit. For example, you constituency where you did so from Bonf, a lot of health problem did it. And every day, you dey suffer the same problem because people them that your constituency, they come and cry to you with regards different other things them inside the health system. Correct?
Yes, you are
So
correct.
it's very much important. In other words, you get power, and the Parliament Oversight Committee get the power for summon people them. But the question is, how many times you don't summon the Minister of Health?
The Minister of Health, I don't summon and want him, but the day way for appear before the committee, though that not will be an excuse, been out of the country. So that's someone
So
of course.
you don't get an appointment with them before you travel.
Very, very good.
So how
Listen,
serious it take una?
Wait, I come. Yeah.
Okay.
As I talk to you, I don't summon then immediately we resume parliament, then get for appear before my committee. Now that thing I want to tell you.
Okay.
They must be serious. That thing, of course, parliament summon you, whichever you look at, I just get for car. You just get for car. If you not come, now that we call contempt of parliament, you will get problem with parliament. So therefore, as we go no more, then people then get for appear back before parliament. And the interview we don't give me this morning, this all don't serve as a basis for other to be further. Thank you very much for that. And only for telling thank you, but I get for telling thank you for this particular one because you don't put me on me too. Usai me say been on the labs, myself of course I get for step in and know what to do.
So if the minister for Cabinet Parliament, then it give you another excuse, say you get another very important, schedule out of the country. What thing you will get for do?
No, that no go be.
Because I think that of course the last time.
Yes. You no go get excuse twice. If you don't give one, the second one you no go give. Where you do, and then Parliament will take its course.
Whose impact way it can make for let una invite, executive arm for come and answer questions?
The impact it go make positive impact because anytime you appear before the committee, any committee apart from even health, they get for raise concerns and then get for raise issues and where you go make the country go ahead. So therefore, if that they happy, then where you go, if you know they make mistakes in your dealings, so at least you will get corrections there. So therefore, it will create a very big impact in some the MDs there.
How many percent will they put from a budget to the health?
Well, it's 10.5%.
Now big money that one day from a budget.
Yeah.
But in the other and a small money as well. But notwithstanding, the government they make some effort.
Yeah, they make effort. We supposed for get 15%, but the 15% we are going slowly. We are at 11, but because of one reason or the other, probably the financial constraints in the country, it was brought down to 10.5.
Okay, so especially for the village community, give me a picture of that your area where you did.
The area where they in the first place, me constituency. The terrain, where you hear about on the streets, see streets of you don't can't remember about water. Mm-hmm. Like me constituency, the other one the inside the water, the other one the behind the water, any side where you want for go pass, you get for cross. So the health situations at times, the health center, the hospital where they close to me from the last chiefdom where are they, we na boom for cross go Trojan, pass you get for cross water. And in that particular aspect, you get for strain because when the vehicle take you get for good go you na the Sewa River before they cross you, then the other motorcar can't take you. All this can cause delay in terms of referrals. So it's a problem. Then I mentioned as we go along, I mentioned about bat infestation. It don't be a very big problem in the centers and where they work. Then don't they distress some centers and very seriously. So then one big thing where I don't find out where I even tell you for see where I get for pick them up with the minister or the Minister of Health. Then even Moyamba, the paramount chief, the PCMP, where he did it himself, the same thing it called reports to me about this bat infestation. It don't deploy centers and very seriously.
So, wait,
so therefore
bat infestation. I know myself not to understand. Do you mean the bats where they fly?
Yes.
Waiting in the
Oh,
actually
they
do
were
to the
the-
center them.
oh, then they go there in numbers. Then they shoot, they do all kinds of things. So of course, then the odor, it can be very much offensive. Then they pour the zinc, then they pour the slow test and the rest. So every day when you go, would get for those sweeping and the rest. So man, if you see the, I wonder if may you go travel for cancer one may you see. If you see there, you will really sorry for the people there. At times, if the people they're not going to sit down at the place again. So now, so the bats and they really destroy the centers and we
So waiting you feel say because if people not able to get access to the center because of bats, then a very big problem for them and the way they live there. What do you feel say for be the solution to them bats then they?
Hey, the solution to the bats and pass we kill them. Pass we kill them because ways and then go there for kill them anyway. Now that make I want go take up and with the ministry for let them do something towards that because it don't they become now alarming. Because not to 1, 2 centers, almost any center you go there, they meet them bats, anyone you go meet them bats and they. So that's a very big problem. And beside that, the health workers and its guide and then they go to the centers and they work and the rest. Women, they know they born at villages again, we're a very big constraint for them. But if you belay down at, we get precipitated labor, we can come on. But if then they come up, you call, then we make sure then they call ambulance, they go pick you, bring you come. So this, of course, is ongoing. Let
me look at the governance part of the health system. Not a secret say corruption seriously they inside the health system. Even recently, we see one report we come up with and they talk about $412,000 we just for procurement on food for training. They do wrong procurement and they waste that kind of amount of money there. And we see that at the Ministry of Health under the Malaria and so we see the AIDS Secretariat as well. Then talk about how many $1,000 where they as well don't mismanage in terms of procurement and other things. Then so this not alarming things. Them we see say the Parliament although oversight not able to do all things. But some issues then the way they come up now, I need for take them up. Say okay, we na Parliament need for take this and make sure say we get no the aid to this particular thing. Let's say if there's corruption not able for sedenting and they not able for sedenting and they somebody else bring that issue up, una for take them up. You don't see that kind of report today and how plenty money wasted at the Ministry of Health inside just 2 months.
We I see reports at the actor now, but like this report we they talk of now, I'm not fortunate for coming across with and nobody not done inform me, but pass you I get from you today. But never mind, that not going be an excuse. We get a committee in a parliament where they oversee them issues. They already highlight now, so who we call the PAC. That PAC it pull reports almost every month. It pull reports, so it oversee the MDs and the rest. Like this, we don't talk of. Well, thank you very much again. I will tell you plenty. Thank you for that. I get for pick up as you go along. For let's see really how this money was expended and the rest.
I will actually show you the actual, thing where they talk about because I'm thinking the Global Fund. Listen this one.
Mm-hmm.
A Global Fund investigation report has found $2 million stolen by officials of the National AIDS Secretariat and the Ministry of Health and Sanitation between 16th to 18th. Yeah? And according to the report, they did it by bid rigging. Yeah? Falsified documents and invoice, illegal payments, and per diem fraud. This is not the global, how do you call them? Global fund. Wait, let's just zoom this thing and read them for you again. Because it's nice that we actually see know them in there. Good. From January to April 2020, IHPAU procured catering suppliers for malaria training courses at a cost of 3.44 billion, where in dollars now 353.113 dollars, yeah, $1,000, $353,113 financed under Sierra Leone. Again, the code ZMOH, Ministry of Health and Sanitation. Similarly, in August 2020, Ministry of Health conducted training events on how to use the health management information system, when are the HMIS, for which IHPAU procured catering services for 604.78 million leons, where in dollars you could say na $62,035, yeah. And under the same grant, where na the Global Fund, then say the OIG did not find evidence that the scheme was set up for IHPAU procurement staff to solicit kickbacks. Yeah, nevertheless, by implementing the scheme, IHPAU violates the code of conduct for principal recipient. The OIG considers the total value of the training 415,148 as non-compliant. So this na the reports. These are just excerpts from the report where I actually don't read for you. So we dey talk about $2 million from January, February, March, April. In just 4 months, they misuse the money then they.
Well, a very good information. A very good information. The only thing we are going to tell you, we search an information and that document we don't read and so do I need them anyway.
Okay.
May you forward them to me. Yeah, may you forward them to me so that as quickly as possible, just like I tell you, thank God I don't invite this institution as you go, then get for appear. The only thing now I get for include I pound for left behind because we talk of then I pound. Now they also involved in HIV secretariat. This is all I don't get. Thank you.
Sorry, Honorable, hold on please. The line they broke, so we want for you find one or you didn't make anything. You hear me?
Yeah, I get you.
Okay, please go ahead.
Yeah, like just I say thank you very much that document may you forward them to me for the fact that then people then get for appear before me that I need that document. And now when they come because we have been they call them, we have someone them. IPAO not been there. IPAO and HIV secretariat not been there. Now I don't listen to the document. I say then also
yes, the document and
I therefore tell me Clark for let someone. Okay, that is good. Yeah. IPAO and HIV secretariat also not get for left behind in that particular meeting now. Or if possible, that of course I will discuss that with the committee members. If they go come in beats, let them not come in cluster so that we will be able to do thorough work as against that particular investigation.
Okay. I think that's very important because the way our money, the government is spend money, don't know when they spend money, and the way how we understand, say the ministry and in other small, office, then they use their money there, so and not they help the people them at all, and the people really they suffer for able to get certain set of people where just they use money out they want for use them. So by the end of the day, if you wanna find out about all of them things here, what thing will be una action? Una get any action una for una we will take against them?
Yeah, you see, Parliament, any institution again in your rules and not to the game. When we don't see them reports, then we go only at the well of Parliament. Only at the well of Parliament. Left with the leadership or any member of the health of the whole house. If the member say we debate and then we debate and bring come to public domain. Now that kind of thing we can do. Or if we will send them to the PAC committee, then of course we will send them there. But we as members of Parliament, we say we get with your leadership. And that leadership, anything you want to do, you just get for discuss with them. Then advise. Okay. So now that we get for do, when we don't look into the issues then or concerns then, we will lay the reports na the well of Parliament. We don't lay the reports na the well of Parliament. We will either debate them, provided a member asks, or you come up with a motion for say, let us debate that particular document. Now that kind of thing we get for do. From there, of course, the speaker, the leadership, of course, as a whole, they have to actually advise on that particular issue now.
Okay, this what they can ask could be probably the last question. I get for cut across politics and the job proper. Like you dey talk, I dey see some amount of honesty in what you dey say, you know, and I dey see like you really want for work. But not so secret say, most of the one them where they are the executive arm. Yeah, ministers, representative or heads of department agencies, you know. Most of them now big member them inside una party, then they all big position then una party at constituency level, at district, regional, you know, level. We mean say you na member of parliament, you not go able go na parliament without the approval of your district committee. For example, if you na chairman for the committee on health, and then the minister of health, now example at the bring am, now you constituency chairman, we mean say you get for need in approval tomorrow for come back in a parliament. Let me be honest in this part. You think say you go able for all them to account if you want for come na parliament and na in all you for let you come na parliament back?
Well, for the fact that question is directed to me, I dey give the correct answer.
Okay.
Me now I dey talk to you. Not the way I get for free. I dey tell you for say me na a second timer. I don't know me first time. This na my second time where I dey count on. If ever they go for third time, no problem. So that's not the way I get for say I not go do this or for let them not give me symbol again and the rest. No. We they work for this country. And if they work for this country, then I they tell you for free. No, that's not the way you get for keeping, you know, under the carpet. If you keep anything under the carpet, that means you don't want to let this country forge ahead. And me not to the kind person that one day. Me want to let this country forge ahead. I like Nami person. Past EB say the other members they say no because you know committee work na a group work. You want to go say no, I take decision. You get the overall saying, but you get for consulting members. If they say no, well, it could be very very more difficult. It could be I repeat it could be very very more difficult. You know, then get that dignity, then get that respect. Nobody not go and let them tarnish in character. I know that very well. So therefore, if the party member don't do wrong, you go and the one way I supposed to do, I did one. Okay, I did tell you for free. Now that make until me you don't discuss something here concerning about what is happening in the health department. Mm-hmm. Well, just sit down and look, waiting for do. Yeah, that would be the best answer we are going to be now.
Okay, because
they on air now, everybody they listen. So whatever you say here, it get for be sort of policy statement.
Yes, please.
That of course I did. So therefore, they work with and send me under for do, and they go do my border. This no Sarah, and they go do and you go see the outcome.
But a challenge for other people them way, especially for some first timers them way actually they look forward for go back.
Well, that of course I'm not gonna deny you, me man. You are a different man. I'm a different man. Wait till I go take some say you not go take. Wait till the next man go take some say the other one not go. So therefore, I not go talk for other person. I go talk for me because I know what's in my heart. Yeah, I not go talk for the other one. And the first time as you are quite correct, then go shy a little bit and say, well, if I do this something, then no, give me some more again. But me no, the afraid that one day give me some more. I say Alhamdulillah. You know, give me, I go say Alhamdulillah. I go see praise God. Yeah. Me no, if God fear
I actually don't tell you say that in the last question, but I beg pardon. Let's ask one last one we get for do with bats and death. You know, not all secret against say the bats and death department now one of the most deprived departments. Until now they talk so, most of them system they not just paper and sometimes if you go trace certain documents at that place, they not go able for see them at all. Yeah, and most them they don't they left them, they not they look at with 2 years for see how serious they for able to treat that department. Say. You don't ever think of that department there of how it for improve?
Well, that question you don't ask me in particular, a heavy question. Where would they not hear? I'm not one for lie. I know say it go haunt me. Not to say I forget about bat and death because why would you talk? I tell you for say I say me a health worker. Mm-hmm. I come out from the health department before I can here. Mm-hmm. So whatever they happen here, I know very well how important is the bat and death department. This bat and death department, which I don't can story in fact, let me tell you for free, is so important in bigger towns. But in our own rural settings, I don't realize for saying in fact nothing in all the even of which day. I tell you the fact, because by right, the birth certificates for the health centers. Death certificates for the health centers or na the NE. Where possible die, you get for know the cause of the death. Where they don't pick you get that. But not happy. So this all na a concern. We have been actually catalog them, and even if we don't come, I still try for catalog them. For la not miss the points as I put across. We even if I go come or not go come, we are get for talk them anyway. This birth and death for say me one day I not even don't summon them. I not don't take say a committee members that say let's go there like now 2-3 people there for let them go see what is happening
then
there.
just left them to themselves, then do what they want for doing all, but they need for look to them because they're very much important. Because for example, if we treat the bats and that's very seriously, sometimes they then send us and say for the do so, no go spend plenty money for the do and because we get proper record.
Exactly. That you are quite correct. You are quite correct. The bat and that's I don't really realize for say not to for overlook because everybody is involved.
Yes.
If you picking up on you sister or you cousin, and the rest every day people then they born and every day people then they die. So if we actually take good stuff of birth and death, I hope say just like the talker. If he says us, me man, you could just go into the record and see everything. So therefore, thank you very much again. I continue for telling thank you because anything when you come with a winner important thing, my brother, I just get for appreciate you for that. The birth and death, even if we want for overlook them, not to that really but not just a word talking. It look like say I get for take them again. These few 2 months we don't left. Then self I get for looking to them business because I don't know say they are very, very much important.
Thank you very much for your time with me inside the program this morning. We appreciate you and we appreciate your honest view into all of this. You make us feel for be politician because you not lie to me at all. You actually talk waiting and waiting you feel say they happen. Yeah, thank you very much. But just that as a chairman, I want to see that you actually be that kind of very hard chairman. You need to be more strong in certain things. Them, I know say in a challenge from Parliament for able to get some oversight things. Them, but in an honest point, one time you just the door check if you go na bats and death this morning, say if you go see what they happen there, you say go shock. Yeah, now and we by 4 streets. Except if they don't listen right now, but you go shock for see what they happen there. A lot of people they where they go on that side they are just too sad because the department just feels say in a monkey dunya a day on their own and then just they do what they want for do. Proper system now they themselves not they get the support at all where they need for get from the Ministry of Health. And one time in the OC they don't say them for changing system. But the truth now, some of them not even want for see how system they change. For let them go digital. Then no one for see them because now only when they dip on paper, then they able to get and kick back from people. But when they go digital, then it will be difficult for them get that. So there's no one for change at all. There's no one for change. So I don't know. You actually need to watch some of them things there. And also the work boku because I get other things them way for debate and other things them. But please, I beg myself, I beg you for you able to pay attention to some of them things there because that one day now in gets the country. For any information so far, now I go tell we when this person born, when he die, all of them things, and it help the Ministry of Internal Affairs for do plenty things them. So please, I call on you for let you see how best unaki able for work for save that particular department. It is strain, it is really constrained.
Thank you very much. I will try my level best together with my committee members.
All right. Thank you very much. I wish you all the best and get a good day and compliment of the season.
The same goes to you.
All right.
Thank you.
In name now Honorable Majesty. Come on. Watch again me list again the exact thing we need for game. Okay. In name now Honorable Moses Bemba Jockey. This time around I don't call him fine name.
Thank you.
Honorable Moses Bemba Jockey from constituency 091 inside Bonth district and same way so they represent the Sierra Leone People's Party in the House of Parliament in the Chairman Parliamentary Oversight Committee on Health and Sanitation. The truth now for complete this program I not be no say we still get honest people them, but I'm glad that I don't meet one today. We very much honest and they tell me about what they do. Also I don't do things, also I not do things and it. we look forward for see how best you can able for add more flavor into the national, issues then for make sure say the life of people then really improve. Thank you very much. Happy New Year in advance.
Thank you.
All right, thank you for you. Don't come and watch. You don't share. You don't like, and you just don't come and see what thing they happen. We appreciate you time. Until we meet again. My name na Aliu Sembepe, the freedom fighter. God bless we country Sierra Leone, where we can call we hard.
Oh yes, plenty organization don't come and go, but this one come for stay because in M, not the heartbeat of God for help the poor and needy. It's the Sidra Women's Organization.
Sidras Women Organization. They come for help with the poor and Sidras Women Organization.
The Sidra Women's Organization will be launched officially on Saturday, the 7th of January 2023. This historic event go on for inside McKinneyton, right now the SLTU Hall. The time now 10 o'clock now morning. As the main aim of this organization now for help the poor and needy, the Sidra Women's Organization would look for extend invitation to all sorry art organizations, especially other sister women's organization for can witness this colorful ceremony. I say we McKinney fumble them. Let we not forget the date again. Now Saturday, January 7, 2023, 10 o'clock in the morning, and the place now the Great SLTU Hall, McKinney Town. This organization is sponsored by a daughter of the swell based in the United States of America, Madam Sidratu Aminata Kamara. The Sidra Women's Organization helping the poor and needy is our passion.
They come for do their best to the poor, east, west, south, the east, and the north.
Afuma me no supported, kare mara afuma mone. Afuma me no supported, kare mara afuma mone. Anye antike.